Hi, I'm Roseanne, and I'm a PT assistant, and I'm going to help Haley get on the CPM. And she's had a total knee, and we're going to get the CPM on and show you how to do it accurately to make sure everything's in place, and then finish up with making sure that if you don't know how to do it, if you think you've done something wrong, you're going to come and ask therapy. Get it fixed up. So the machine is always on the table. We don't want to have any on the floor or the window ledges. And then we're going to bring it over to the bed. And then I'm going to make sure that all the cords are right. And a lot of them do have the long, they're stretched out and they get in the way. So make sure that they're not across where the machine works, the track. This is going to thump. The cords aren't strung across the track. And there's enough space under here that this cord can be underneath here safely, so, and not get the cord pinched. And the cord that you plug it in with, you're going to make sure that it's not across the space where the patient would or anybody would walk. And if I set the machine down at about where the bend of Haley's, we weren't using name, bend of her knee is, then I won't have to adjust it as much afterwards. Put the bed down, slide that away and set it down beside her. Ruth, I'm going to cut us. Okay, so we've got the machine set on the bed. And then I've got the bend of the machine next to the bend of Haley's knee. And I'm going to lift her leg up, and I'm going to tell her that we're going to lift your leg up together. And lift that leg up and slide this under. And carefully tuck that under. When we get it in place, then we're going to just check her knee and make sure that the bend of her knee is at the bend of the machine. And we can use a towel here, towel, blanket, washcloth, something here, or sometimes it's even just their clothing, just that when that comes up and bends, it rubs on their thigh. And it seems to do that more for the women than it does for the guys. We're going to hook her foot in here, just gently around here.
Now, how do you know when the heel's in the right place?
When we want her foot to be, her knee to be, the kneecap to be pointing up. So her foot may not be straight up, it may be out to the side a little bit. So we want her kneecap pointing up. So it should be adjusted, but people do move their feet while they're on here, so you may need to tighten, get it back in position and tighten it.
You mean the foot pedal?
The foot plate here.
Plate, okay.
And also sometimes this will come loose. If Haley's somebody that lays here and wiggles her foot back and forth a lot, that foot plate may come loose. So you just want it almost vertical and then tighten it up. Okay. And then we're going to put this other pillow underneath of her other leg so that her leg's out straight, okay? And her heel's up off the bed. Mostly we're keeping that heel up off the bed. We don't want the pillow up underneath of the knee, okay? So we've got the machines there. We're going to put this strap around on the lower leg because we're trying to keep her lower leg, the shin, the shaft of the tibia, in line with the machine, okay? Put that around. There's Velcro on both ends. This Velcro has been known to pull things loose, so if you feel like something may have came loose on the frame, to just hook it around there again. And we can show that more later too. Okay, so Haley's hooked in there. I've got the pillow under. The machine's sitting level. Some of the beds have there's a bladder type on the bed, and so the machine may be tipping out or something. Just use a towel underneath or something to keep the machine so it's up and level. Okay, so the machine is sitting level on the bed. Some of the beds having the bladder on, they will tip or something. Okay, and also if you can see this, the bed should be locked, the knee gap should be locked off, and you can do that on this bed. Just right underneath of here, just reach under and it says side rail knee. You lock that off, like turning the light on, okay?
Great.
And then when she puts her head up, the knee won't come up with it. The therapy department sets goals for the knee patient each day. They start out at 0 to 40 down in surgery if that's what it has on the doctor orders. And then the 0 to 40 degrees, so that their knee is going to bend that far. And there are some variations, but we check the order, and then we're going to mark what we want the machine to be set at, or what their goal is, on their marker board. Okay? And try to keep that dated. And so what you're working for each day is to get the machine to go up to that amount. You have to take into account the patient, their pain level, what they can tolerate, and other things with the care, you know, how the knee incision is doing. Okay? So we're going to have her, and you just the red button. You push the red button to start. And the machine is moving at a slow rate. If I push this here, it'll tell me that it's at 30, and that's the lowest that the rate will go. That's where we want it to be. Okay. And then then you see the flexion. The flexion button is this bent leg here. It's at 48 degrees. If I wanted to increase that, because I looked and the goal says that they wanted to get up to 55 today, so we can increase it. You can hold it down or just tap it to get a single number. Okay? And you can do that as the machine is moving. And then the numbers tell you just where the machine is now. And if we don't make any changes, it's just going to go up to 55. It's going to turn around and go back down. Just keep going between 0 and 55. And you're going to be able to see easier as her knee comes up if that's in line with the machine. And actually, it is. Sometimes the knee looking from here isn't as accurate as, you know, just feeling underneath. So, and it feels like it's in line for you. Okay.
Mm-hmm.
Okay. And so, because we want to keep the kneecap pointed up, I'm going to use this towel here. It's very common for them to have a tendency to roll out. Okay. So we want that kneecap up. So I'm going to put that towel roll here because we're trying to control the movement of her hip. Sometimes you'll find it's down here. That isn't controlling anything. We want to control our hip motion.
Sure. So
we're going to put that towel roll here, and depending on how ample their leg is how much you're able to tuck that in. But hopefully you can tuck it in there and so you're keeping the kneecap pointed up. Okay, the strap's going to help a little bit, and then they've been told, you know, to reinforce to them that you want your kneecap pointed up
toward the ceiling.
Yeah, toward the ceiling, so that if it's not, they can tell somebody.
Okay.
Because we don't want them wearing on that outside of that joint. And making sure that she's comfortable, making sure her hips are flat on the bed, she doesn't have pillows tucked in from somewhere. And then we put either you can place or let her place the washcloths, something that it's rubbing on her legs between, to make sure that it goes through a whole repetition or two. And you're going to do that while you're setting the parameters on the hand control. And so you don't just go in and put it on and then leave. You're going to stay there. You don't have to be standing right by the bed the whole time, but just making sure that they're comfortable as it goes through the whole repetition. And it is slow. It takes a few minutes. We're not going to have the patient eat or have the machine running while their tray is over the table, because there's a chance that leg can get trapped and they can't reach the control to turn it off, so you don't want that leg to get trapped underneath the tray table. And it's best if they sit up in the chair to eat anyway. So when I come in and I would probably check to see how it's going, and then we're going to turn the machine off. It's easier to get the machine back on when it's down to 0, so I'm going to let it go back down to 0 on the settings here, and then turn it off, so you're leaving it good for the next person. You're going to make sure the cords are out of the way and get her unhooked. I'm going to hook the Velcro back to itself so it's not going to catch for somebody. We're going to take this other pillow out. Okay, then she can use that leg if she needs to to help us. And then we're making sure that you're communicating with her so that she knows what's going on. Less surprise makes less pain, I think. And get that down to a lower level. So if you can bend this right knee up and then help me lift your leg up. I'm going to slide it out so you can put that leg down. And you've got everything free and clear from her, and you can lift it up onto the table.